All right. Well, thank you for spending your lunch hour with us. This is just the weekly update from the health department. And let's just go ahead and get started with our metrics and numbers. This is, hopefully you can see my screen. This is our local data dashboard showing you the number of positive hospitalized patients and positive ICU patients that are in our county right now. I think everyone is kind of coming to an agreement that the number of cases in the community are surging really hard, but in some ways that number may not actually be the most important one to track because the home testing is not being reported. And also many of those cases are thankfully very mild. So it's probably better for our practical purposes to be tracking hospitalizations. And there's really a push at various different levels and layers to really move to just looking at hospitalized cases instead of community case rates. But nonetheless, that's what we're going to focus on today. So in terms of hospitalized cases, we are basically, this little hump here, this double hump, represents what the Delta surge did to us. It was really a Delta peak and then a plateau. And then really just at the start of this year, we really just had a huge shooting up with hospitalizations related to the Omicron wave. So that's kind of what we're experiencing right now. We're currently in the high 500s, probably going to end up in the 600 range and meeting the last winter peak, which you see here as the tallest peak on this top left graph. In terms of the ICU patients, again, the Omicron wave is carrying a lot of people into the ICU. So all of this business about it being a very mild version or a very mild variant over the course of a population as large as ours, that just doesn't hold true because there's just so many vulnerable people who, because they have maybe comorbid conditions, certainly not vaccinated is a big factor. They do end up in the ICU, just like with all the other waves that we've experienced. So like I said, in this box, Fresno County hospitalization and ICU cases are nearing last winter's peak. This is putting a severe strain on all hospitals. What you actually don't see here, and what I think is a huge void in our discourse about COVID, is all of the non-COVID volumes that hospitals and clinics are dealing with. I mean, all of those are really coming in so fast and furious that is really pushing our facilities beyond the tipping point. I mean, they are being as creative and flexible as they can, but they are really just fragmenting in many ways. And we're trying to support as best as we can by helping them to add capacity, by figuring out ways to get patients transferred out of hospitals, if at all possible, and into skilled nursing facilities. But there's also, something else that you don't see here is that the skilled nursing facilities are deeply impacted by the same factors, including staph infections, staff shortages, low morale, and a lot of different outbreaks happening at long-term and skilled nursing facilities. So we have a lot to deal with in the healthcare sector. One thing that I'll remind you to do again is if you do have patients in the hospitals, please discharge them early in the day. Because that really helps the hospitals do planning for things like bed control, et cetera. So please, if you are working in that space, this might be common sense, and I apologize for being presumptive, but this is a request that our hospital partners are putting out there to just let everyone know, get your patients discharged and ready for discharge earlier in the day so that those beds can be turned over and used for patients that are waiting downstairs all too frequently in our emergency departments, just boarding and waiting for beds. Let me show you what the state modeling looks like. The scale here is so off that it's almost hard to read this, and you might be fooled into thinking that this is a very gentle peak that we're experiencing, and it's absolutely not. This is the highest, some of the highest numbers that we've seen. Like I said, we're up in the 580s right now. It doesn't seem like it's going to get that much higher. It may reach as high as 650 to 700, but it's going to stay that way, according to the state modeling, all the way through February, which is what I've been messaging for several weeks now, is to say that we will probably have pretty intense pressure on our hospitals for through the month of February. And that's kind of what the latest modeling shows. I just hate that it looks so flat, because it certainly doesn't feel flat when we're all working in our clinical facilities, and these numbers are just, they feel astronomical. Moving forward to the regional forecast. So this was shared on the state call with all the health officers yesterday. And this is the state epidemiology team just sharing their modeling broken out by region. So you see the Bay Area has kind of reached their peak and maybe beyond their peak. Greater Sacramento just seems to be right there. Northern California and San Joaquin Valley, which is where we are still on the rise. And again, you know, once these really black dots stop, it's really just predictions all the way after. So we don't know if this is the peak or if the rise will continue. It's anyone's guess. It's much easier to see that Southern California may actually have peaked and plateaued or is coming back down, and same in Northern California. So that actually is going to lead to some regional variation, as you see in this headline here. And we'll just have to wait to see our peak, hopefully very soon. And then, you know, hopefully a decrease in the number of new cases, or as shown here, in the number of hospitalizations. This is some sampling that's done in our wastewater system. I haven't been sharing these graphs with you, but I just wanted to share it today. Just FYI, that, you know, we've actually been sampling different wastewater facilities. Wastewater sites. With the partnership of the wastewater facilities. And this is kind of a new paradigm, is, you know, during this pandemic, people have really figured out the technology to where they can actually dial down to the variant that's present. And so it does give you a lot of epidemiological information. It just seems like it's redundant because we already know that we have a surge going on, but this is the kind of stuff that will allow us to hopefully catch the next wave. So it's probably not going to give us too much good information this time, but when this wave subsides, and I guarantee you that it will, there will be another wave to come after it. And it would be really great for us to have the tools to detect that wave as early as possible. So that's why people are setting up all of this wastewater surveillance. It's a really cool technology, and there's a lot of good information that you can get. You can find out COVID variants. People can actually test for different chemicals and stuff like that. So there's a lot of toxicology research going on, looking at things like fentanyl and other drugs of abuse in wastewater to see how the population is being affected by different illicit substances and things like that. So it's really interesting. It's moving quickly, and I think that it's here to stay. And you're going to hear more about wastewater surveillance, giving us answers probably even earlier than clinical cases start to come into our clinical spaces. A little bit of sad news. We were just looking at this yesterday, my team and I, and the state actually shared this graph that I'm showing you here. And that is that, you know, kids are not immune or excluded from this Omicron surge. And in fact, the typical wave of Delta actually didn't really create that many admissions for kids around the state. But Omicron seems to really be pushing this level of admissions in the pediatric population, ages 0 to 17. So this is statewide. You can just sort of see that these yellow bars just, like, you know, quadruple in size just as soon as the new year turns over, and even before, around the holidays. And that's basically what the state is reporting. And while the state seems to be coming down overall, the news is actually even worse for Fresno and Madera hospitals. So we combined those two counties for this graph because of Valley Children's being in Madera County. And here you can see again, we've had waves of increased admissions before. And here you see that the light bars represent non-ICU admissions and the dark bars represent ICU admissions. But this one really just dwarfs the prior levels in terms of kids coming in, being admitted for COVID or with COVID. And just off the record, we know of at least 2 fatalities in this age group that we are kind of investigating and making sure that that the due diligence is done in terms of filling out death certificates and things like that. But this just goes to show you how tragic this dimension of the surge is that it is affecting kids. Kids are being admitted to the hospitals and the ICUs. And unfortunately, we're actually now starting to see fatalities as well. So again, not something that we're going to, broadcast to the media very, very broadly, but if you hear about it, just know that that's what's going on. It's not entirely surprising, but it's obviously we want to be sensitive to the families and do our investigations and things like that to make sure that if there's an outbreak or something like that, that we're doing our due diligence to help mitigate that. Just a couple of CDPH news items that I wanted to share. You may have heard that they actually had to push back the deadline. So it's actually going to be extended to March 1st for the boosters for healthcare workers to come into full compliance. And the reason is basically Omicron in one word, that this surge has really just disrupted so many operations and has caused so many people to fall ill that they weren't able to make the deadline. And obviously trying to get to a vaccine provider during this surge has been very difficult and challenging. So they've actually pushed that deadline back to March 1st. This is going to come out in AFLs that will be amended because there were 3 AFLs that were put out before that covered boosters for healthcare workers in various different sectors. And so those are going to get amended, but just remember now, they have till March 1st to meet that booster deadline. We put out a news advisory here because we just this week noticed a ton of pop-up testing sites that may or may not be honest brokers. And we just want the community to understand that, caveat emptor, buyer beware, and make sure that you are dealing with a legitimate testing site. Whenever we get complaints or reports about these, we actually are doing investigations as much as we can with asking for people's CLIA licenses. They have to have a medical director on file, so we're looking up that person. So we're just trying to make sure that we don't have any unscrupulous or opportunistic vendors that are not doing all the right things and certified in the right way. Because like I said on my media yesterday, bad information is worse than no information. And whenever people do crappy tests or give people bad news or bad information based on these testing sites that are not above board, then that's just going to that's going to be very counterproductive. So if you hear about that, reach out to us and hopefully you can be part of the solution by actually offering testing if you do have that capacity. And thank you to all of you who are already doing that. Again, my plea to extend your hours if you're in the primary care, urgent care, ambulatory care setting to really help offload the hospitals because people are still showing up to area emergency departments asking for testing done, and whatever we can do to keep people out for that need and also for any other minor needs that don't need to be at a hospital will help tremendously. I know it's really hard because there's so much pressure to get tested so that people can get back into the workforce or back into school. All right, let me show you a couple of new websites and then I'll actually stop sharing this screen and then I'll drive over there so you can see them in live time. So one of them is actually a new tab that we have on our Fresno County website. And this is going to show you all of the monoclonal antibody provider sites and also eventually all of the Evusheld and Paxlovid pharmacies too. So right now it has the monoclonal antibody provider sites. So this is basically just a web version of Dr. Zweifler's advisory that he updates every week. We're going to move over to a web version of that to make it easier to navigate. And this is what it looks like. And then I'll show you that in real web time in a minute. And the next thing is really exciting. This is a federal website called the Hhs Treatment Locator. And it's located at this link. And this treatment locator, again, you can tell it's designed by the federal government because it just has no graphic design chops whatsoever, but it's actually very useful. You can actually plug in your zip code and then it will show you in your area all of the places that have the oral medications and Evusheld. So Paxlovid, Molnupiravir, and Evusheld. And it gives you a nice list here and then it also maps it out. And then it also, I cropped this off, but it gives you the total number of medications that are in your area. So it's going to be really useful moving forward. And that's why it's so important for all of these sites to continue to update their inventory on a daily basis. So you've heard us say this before, that if you're in the HPOP system, the HPOP system has to be updated every day or you're going to get cut off. And this is exactly why, is because the feds are actually using that inventory data to build this map and to keep it live so that it's updated in real time every day to help all of us locate where we can send our patients. Like here you see, for example, this is the Kings Canyon CVS, and here they've been allotted 100 courses of Paxlovid, and they have 51 courses available. So at the time that I pulled this up, basically that was the data that was applicable, and all of these dots are actually things that you can look up to. So it's going to be a really useful tool moving forward. I know there's not a lot of doses, so no map is actually going to, make more doses come out of the sky. But as we get more doses in the system, a map like this will be really helpful for all of us to efficiently direct our patients to where to go to pick up these medications, which will hopefully keep them out of the hospital. So let me stop this share, and then I'll take you over to the next screen. And then I promise we'll get to the chat. So keep throwing your questions in there, and I promise we'll get to it. I just don't want to lose the, I don't want to lose the thread here of where we're going with this. Okay, let me see where this went. Sorry, whenever I try to drive, it always ends up being, okay, so that's not the one I want. Bear with me here. I'm gonna just pull it back up very quickly. It's really neat, and I just want you to be able to use it during your clinical duties so that you can be very facile with using it. So here's what it looks like. Oh, sorry, let me share my screen here. Okay, so it's it says COVID-19 Therapeutics Locator. It's a HHS website. Like I said, this shows you what's going on around the country. And then this little microscopic magnifying glass, again, they're not going to get any design awards for this site, but it's actually useful. So you just, let's do 93701 because that's kind of central to where we are. And this shows you the Fresno area, and then you can actually zoom in or out and see all of the places that have it. And look here, as you zoom in or out, these columns on the right actually change their numbers a little bit to let you know that the map that you're looking at has this many allotted doses of Evusheld or the other medications. So I think this is just super cool. And then whenever you click on these green dots, you can see, well, here's the Rite Aid on Fresno Street, and it has molnupiravir. They still have 158 doses. And here's the CVS Kings Canyon, which has 35 courses of Paxlovid available right now. Again, this is updated every day, so just keep that in mind that it's not going to be a minute by minute or an hour by hour count, but it's pretty good because it's daily. And on the left-hand side, you actually get a whole list of places that if you or your staff want to start calling around or really do more investigation about, where do you want to always send your prescriptions and set up your electronic prescribing there, this is going to be very useful to you because this will help you kind of have a global snapshot of what's going on. So hopefully this makes sense. I know that it doesn't answer every need, but I think it is a great advance. And it's really important for all of you that are using this as dispensing sites to please update your HPOP. This is why it's so important to be in HPOP, to have your credentials, and then to update on a daily basis, because all of us will be relying on the data that you put in to get mapped to this site. Okay, one last thing, and then I promise I'll get to the chat questions. So let me go back to our COVID updates, and let me share. I saved kind of the good news for last. And this is basically the table that Curtis Jack, our guardian angel with the Mohawk, actually submitted to the state to say, this is what we want, please send it to us. So this is what we are expecting to get, this is the table of medications. So with Evusheld, as you heard me say last week, there's two points of allocation, and then those hospitals are actually redistributing to other partners to get Evusheld out into our community and administered to our patients. And that includes CRMC and St. Agnes. Thank you so much for those teams for setting that up and going out of your way to make sure that system is working. And then for the oral antivirals, we actually were able to add 2 more pharmacies, including one on the campus of CRMC, the ambulatory care pharmacy. So they should actually be receiving some Paxlovid and molnupiravir next time it's allocated. And again, it should be in the next couple of days. If Curtis is on this call, he usually has a better idea. But we submitted on 124, and usually the state turns it over and sends it within the week. So they might have already arrived. The other ones are the Kings Canyon CVS, the Rite Aid on West Shields, and PharMerica, which actually serves a lot of our long-term care facilities and skilled nursing facilities. So we wanted to make sure that they actually had access to those medications. So while this is not a perfect distribution, it seems to be the best that we can do given the very, very low numbers of doses that are coming in. So just keep in mind that there's only 4 sites right now. And for all practical purposes, the first 3 are the ones that your patients will actually be able to get to and access. And there's lots of molnupiravir if you do consider giving somebody an oral medication and Paxlovid isn't available, then think about giving them molnupiravir, because it's not as great as Paxlovid according to the clinical data, but it's pretty darn good. And I'm hearing good things from our local providers about how well it's keeping some patients out of the hospital. With the monoclonal antibodies, again, the EUA was pulled for all of the monoclonal antibodies except for sotrovimab. So that's the one that the federal authorities are allocating. And this is kind of the breakdown of all of the different places that are getting it, which I think is great news. This is kudos to Dr. Zweifler, Dr. Lindscheit, and really all of the people listed on this table for providing so many doors for our patients to walk into to get monoclonal antibodies, because we know that this is another great way to keep people out of the hospital who have contracted the COVID infection. I just put the email for the Mohawk. If you have any questions about this process or system, or if you have any suggestions, or you want to be added to this list as a provider of either sotrovimab or especially Evusheld, please reach out to us. We want to be able to expand this list and really cover as many geographic and community locations that we can, but we can't do it without your partnership. So please reach out to us. And then lastly, I just wanted to brag about one of our own emergency medicine residents, Dr. Jessica Martin Moreno. She's actually featured in the New York Times today. She was quoted in an article about physician burnout, and just has a really lovely and inspiring quote that, you know, our hospital, CRMC, sees very underserved patients who have very little interaction with the healthcare systems. And these are the patients I've committed myself to serving. And she goes on to really commend all of her colleagues and their generosity. So thank you so much, Jessica. We're so proud of you for stepping up and saying these really heartfelt words during this very challenging time. I urge all of you to look at this. And this article is actually much longer. I just pulled out her quote, but it's actually quite inspiring because it's all about how California, experiencing this surge with all of the challenges, is finding ways to continue to do the hard work of taking care of people. Let me stop there and see if there's any questions. Please go ahead and unmute yourself or raise your hands if you have any questions that you want to share with the group. If not, then I'll just go through the chat. I see Dr. Zweifler's on. Thank you again, Dr. Zweifler, for all the hard work that you're doing. If you want to make any comments, then please feel free. Otherwise, I'll go to the chat.
The only thing to add is just to really, Dr. Vohra, you always do such an outstanding job of covering such a broad range of information. But to put a plug in for Evusheld, for those who are autoimmune, immunocompromised, we really haven't seen the kind of uptake on that we would have thought. So these are folks who the immunizations just really don't work for. So Evusheld is like giving them long-acting immunity. It's like giving them a vaccine, which their bodies are unable to generate in response to the vaccine. So if you have immunocompromised individuals on high-dose steroids, transplant patients, cancer patients, et cetera, those are the folks who really should be getting Evusheld. And we know that those patients are out there. Those are the ones who are going to end up in the hospital and die. So the Evusheld is underutilized right now. We have some good sites to provide that. And you as PCPs can really, and specialists who are on these calls, you know, we're really looking for you to identify your patients who are eligible for Evusheld. So thank you.
Thanks, Dr. Zweifler. And as I understand it, it's just a quick injection, right? Just in and out. So it should be a pretty short visit.
Yes, just 2 injections. Yes.
Okay,
Yep.
so it's not like an infusion that the person has to wait an hour or something like that. It's just a quick injection, maybe a short observation time like we do with vaccinations.
Correct.
And they can go back out.
Dr. Zweifler, can you hear me?
Yes.
Sorry. I don't know what's. Can you hear me better now?
Yes.
Okay, Dr. Zweifler, the question is, what I have a UFOD. One of the problem is the side effects on the listed as MI and stroke. And as soon as you tell the patient that, they just refuse to take it. So any suggestions?
Balancing risk and benefit. We see very real risk from hospitalizations and deaths for immunocompromised individuals. We could look to try and get some more specific data on those rates, but the chances of getting COVID are much higher than than the likelihood of MIs or strokes. But you know, you raise a difficult question. You know, as clinicians, do no harm, and you know, so some patients are much more concerned about COVID and are likely to you know, be much more motivated for the Evusheld. Others are more risk averse, and so you know, kind of informed decision making is particularly important in this case.
Any other questions? I see there's questions about the booster requirement being extended, and that's coming from the state. That's really something that didn't get a lot of press, but it's out there. And in fact, Sim has shared this website that I'm sharing, and it just says extended the compliance deadline for booster requirements to March 1st on the state website. And this is just their FAQ. Sim has actually also shared the actual health officer order, which also reflects that extension.
Thanks, Dr. Vohra.
Yeah, sure. It's, you know, a little ironic because these vaccines are, you know, as more time goes on, they're less and less effective. So, but, you know, I guess they had to do something to, you know, make sure people got their booster. The boosters are helping, even though they're less effective than they were against Delta, they're definitely helping. And so I definitely, you know, I thank goodness that I got mine before I had my Omicron experience. And the vast majority of people that get their boosters actually have a very mild case of COVID if they get it at all. So that's exactly what we want to happen for our healthcare workers who are kind of in the front lines and unfortunately exposed to COVID all the time, either at work or at home or in their neighborhoods. And we just want to make sure that they're fully protected. So it makes sense that, you know, boosters are necessary. It's just, I wish that they were a little bit more effective. Any other questions or suggestions or really comments or observations? You might have heard about this even new stealth Omicron variant. So the Omicron variant is kind of now starting to show It's many different colors, I guess, and now they're subdividing it into different types of Omicron, subtypes. Right now, none of them has really risen to the level of concern that we're dealing with something new or something different or something that's really going to change the overall trajectory of what we're dealing with. So it's kind of a watch and wait situation. I didn't even include any links on today's presentation because I couldn't find anything worth sharing. But it's out there. You might start reading some headlines about this new stealth Omicron or a different type of Omicron that's being identified, especially in European countries. And right now, again, people are just kind of watching it and just seeing what exactly it does. It doesn't really change the fact that we're dealing with the original Omicron, which is causing enough problems, and we're just trying to keep our heads above water with that. So I think that's it for today's presentation, unless there's other questions or comments that anyone has. I know it's hard out there. Please be careful. Please stay safe. Give yourself time to recharge and rest because that's super important to just maintain your health. And please join us next time and we'll share out these updates on a PDF later this afternoon. Thank you all so much.
Thank you, Dr. Vohra.
Appreciate it.